The Department of Midwifery in the School of Nursing and Midwifery at the University of Health and Allied Sciences ushers you into a week celebration as part of the Global Cancer Awareness Creation celebrations. For today, we have for you a panel discussion with seasoned midwifery practitioners and a wonderful hostess. We have a mouth-watering session for you. Join me. Come along.
Good day, everyone. Welcome to the maiden edition of the Breast Cancer Awareness Month celebration, organized by the Department of Midwifery in the School of Nursing and Midwifery of the University of Health and Allied Sciences. As part of the celebration, the Department of Midwifery has initiated this program to educate us on breast cancer. And I have here with me two seasoned midwives by the names Ms. Dinah Edu and Ms. Portia Ahiaku to help in the discussion as we educate the university community and the whole nation on breast cancer. Our guests have over 10 years experience in midwifery practice, and they are here to share with us their experiences in breast cancer care. I would want Ms. Dinah Edu to tell us more about herself and her clinical experience.
Hello, thank you. I'm Dinah Edu, a midwife. I've practiced for over 10 years, and I'm currently a faculty of the Department of Midwifery. I specialize in labor and delivery care, and then I've gone on awareness creation for breast cancer and other maternal and neonatal complications for, I think, the past 5 years.
Okay, thank you. Portia?
I'm Portia Ahiaku. I'm a midwife specialist, a member of Ghana College of Nurses and Midwives. I've practiced for over 13 years in the whole teaching hospital. I'm also a midwife educator. Thank you.
Thank you very much. So as you can see, we have seasoned clinicians to come and discuss with us their experience in breast cancer care. We'll go for a short commercial break, and when we return, we'll delve more into breast cancer. Stay tuned. Welcome back to the show. If you just joined, this is the Breast Cancer Awareness Health Month celebration organized by the Department of Midwifery in the School of Nursing and Midwifery. We have here with us Dinah and Portia, who are midwives, to guide us in the discussion. So Dinah, tell us about the inspiration of the whole breast cancer celebration. We know that people make a whole lot of educational programs during October, but what incited you to start what is happening in Uhas right now?
All right, thank you once again. This, as you said, is our maiden program when it comes to breast cancer awareness creation, and it's inspired by one of our students. Let's say Amma, one of our students, was diagnosed with breast cancer, and then unfortunately it had reached the advanced stage and she couldn't make it. Unfortunately, she passed about a week ago, and so this is in honor of her. Even the plan was in place even before she passed on. So we thought about it and realized that being a health university, if we could have Amma suffering and getting to a stage where there was no return, then it's a problem. Because if it is happening in a health institution, then what is happening outside? And so this comes in to create awareness within the university community for our students, and then project it to the general public so that we know that breast cancer is real. We know that if something is not done about it early, it may be fatal.
Wow, that's very inspirational. And thank you to the whole team that puts this whole session together. I'm sure everyone out there would listen attentively and learn from it, because I'm also surprised. Being in a health institution, we should expect that breast cancer should be something that we can detect early, talk about it, no stigma, no fears. But then for someone to go through this, even amongst us, then it's a big deal. And I think we should, this session would be very insightful to people. So tell us, what is breast cancer?
Okay. Breast cancer is part of the cancers that we are dealing with globally. But then when you come to Ghana, breast cancer is the commonest form of breast cancer, or of cancers that you would find among women. Breast cancer is abnormal growth of the cells in our breast. You see, as human beings, we have cells everywhere in our bodies. And then we have the cells being peculiar to certain parts of the body. And we have peculiar cells that are in the breast. But then unfortunately, sometimes things happen and then the cells begin to grow abnormally. And then when they grow abnormally, they form lumps. And then they can spread through the breast into other parts of the body. So that is breast cancer.
Okay, Portia, can you tell us, she's told us what breast cancer is. How, if she's talking about the cells developing abnormally and it forming lumps, how can I detect? I'm sure we have lumps, but then how can I detect this is a good lump, this is an abnormal lump? How can I detect breast cancer?
Okay, so first of all, we start with the self-breast examination. The woman knowing herself, knowing her breast, and we encourage every woman or every lady in the fertility period to examine themselves after their menses. They can examine themselves to get familiar with their breast, so that if there's something abnormal, it can be easily detected. We also have the clinical breast examination that is done in the health facility, where the nurse or the midwife or even the doctor does the breast examination using the clinical lens. So even though we also use our hands to palpate the breast, we are doing it from the clinical angle. And then we also have the mammography, where a special machine is used to detect changes in the breast. You can also use the ultrasound as well. So these methods can be used to detect breast cancer at the early stage.
Okay. I want you to delve more into the self-examination. Not everybody might have access to the hospital rapidly. Not everyone might probably have access to the ultrasound. So if I'm to examine myself at home, how do I go about it?
First of all, you have to undress from the chest down. You can stand in front of a mirror, put both hands on your hips to look at the breast. You are looking at the size. Surely one breast is a little bigger than the other, but if it becomes very obvious for you to notice, then there's surely a problem. You also look at the nipple to see if
we have a dummy here. Can we use it to
here. So stand in front of the mirror with the hands on the hips to look at the size of the breast, the shape. And then you start with the palpation. We have breast tissues extending into the armpit. And so we usually want to start the examination from there so that you don't miss that part of the breast. So I can also use mine. You put the hand of the breast you are examining at the back of your head, just to extend the tissues for it to be easy for the woman to palpate the breast. And then you start from the armpit. You try and palpate to see if you feel anything abnormal. We already have the normal tissues of the breast, but the lump feels like an orange seed or peanut. It's just like a little lump. Sometimes they are mobile, they can move, sometimes they are fixed. So you palpate the breast tissues, make sure you go around until you get to the areola, the darkened part of the breast where the nipple is situated. You press down a little because sometimes a lump can be there. And if you don't get there with your hands, you may not be able to notice. After that, you gently squeeze on the nipple to see if there will be any discharge. We don't expect a woman who is not lactating, you are not breastfeeding, then you shouldn't have any fluid coming out from the breast. And so you repeat the same procedure for the other breast.
I can do this myself?
Yes, it's not difficult.
If I have a husband, can my husband do that for me?
Yes, if you teach your husband, he can equally do it for you.
How would his lens be the same as the clinical lens you're talking about?
So what we advise is that if you feel anything abnormal, then you come to the health facility and we will also do that. And then we can back it up with the mammography or the breast ultrasound.
With the Dinah, with the mammography, is it accessible in all hospitals? Which facilities have this mammography tool that we can use?
Okay, it's not accessible in all the facilities, but then there are designated places. I mean, the secondary and the tertiary hospitals, you get it there. And so even if you go to a facility where they suspect something in the breast, they would refer you because it's a link. The Ghana Health Service or the Ministry of Health is a link. And so if they suspect something at the peripheries or the basic level of healthcare, they would refer you to places that the higher ways of detecting whether it is indeed a cancer. You'll be referred there, and then the test will be done.
Oh, okay. So then the basic is the self-examination, then they take the referral on to...
Yes. So you don't necessarily have to go to a higher facility just to do the breast examination.
Okay.
You can go to any facility nearby.
Okay.
If something abnormal is detected, then you'll be taken up, you'll be referred to the higher facility.
Okay.
For other
Is it expensive to have these ultrasound scans and even the examination? If I do it myself and I find a lump and then I go to the hospital facility, even for them to do the hand examinations for me, is it expensive?
No, it's not expensive as compared to the treatment of breast cancer. So we advise everyone to get screened. For the mammography, it's advised that women who are 40 years and above can have the mammography done because of the race, even though they are not so much.
Okay, so now it's easily accessible. These examinations are easily accessible, especially the basic ones.
Yes.
Yeah. So compared to the cost in treating this, can you tell us, Dinah, about the rate of breast cancer incidence in Ghana?
Okay, currently we are looking at around 4,500 cases annually. Wow. And that is scary.
Yeah.
Because it means it is getting higher and higher each day. And then the problem is that we are not catching it at the early stages. We are getting them at the late stages that virtually nothing can be done to salvage the situation. So that is where we are now in Ghana.
Okay. What do you think might probably be the cause of people reporting late?
Well, I think our culture, and then the first thing we go to when we have health problems. Most of the time, when it has to do with the breast, you know, the breast is a sensitive thing, and so we don't want people to see our breast. Even when health sectors, health facilities mount these things that people should come in and examine their breast, they wouldn't want to go because of how private the breast is. And so someone may be having the lump in there and knows that the lump is there, but going forward to the health center is a problem because she's shy. And another thing is that people do not know about the cell breast examination. So they do not know, you know, the cell breast examination, you know, we need to do it frequently so that you know the shape of your breast. You know the size. You know what was there and what is not there. And so if it is not being done frequently, people do not know the changes that are occurring. And so that is why we are getting to the hospitals in late stage.
Okay. Portia, can you tell us the age range that breast cancer affects? Because you mentioned the lactating mothers, if you get fluid coming out, then you shouldn't link it to that. But then which age range should we look out for when you're talking about breast cancer?
Okay. Previously was linked to women in the older ages from 50 years and above, but I can tell you that currently we are getting ladies even in their 20s reporting with breast cancer. So it's affecting women of various ages, not specific to just a particular age group.
And what do you think is accounting for this breast cancer incidence and also the age dropping to the 20s?
I think our lifestyle can also be part, especially these days you find young ladies indulging in smoking, excessive alcohol intake, and then our diet is also part. Most of us are obese or even overweight, and some of these things can account for breast cancer. And then the family history is also part.
All right. We'll go for a short commercial break, and when we return, we'll talk about prevention measures and then management of breast cancer so that it can aid us to report early and live a healthy lifestyle. Welcome back to the show. If you just joined us, this is the Breast Cancer Awareness Month show, proudly organized by the Department of Midwifery in the School of Nursing and Midwifery, Uhas. We have our audience here with us who have a lot of questions to ask our panelists on breast cancer. And so we'll give them the opportunity to ask the various questions that they have based on the discussions we've had so far, and our panelists will answer them.
Please, at what age should the woman start self-breast examination or screening? Thank you.
Please, I would also like to know if family history increases the risk of breast cancer.
I'm grateful to be part of this insightful conversation. I would like to know what lifestyle choices will reduce my chances of developing breast cancer?
Thank you. Please, as you talk about a lifestyle, I also want to know if there is any particular food or medication that can promote the breast cancer development. Thank you.
Diana and Portia, you heard them. So we have 4 questions here, and the first one is, at what stage should self-examination be done? Portia, can you help us with this one?
So it's generally recommended that by age 20, the woman should start the self-breast examination to familiarize herself with her breast, to be able to know her breast tissue, her normal, so that if there's anything abnormal, she will report quickly.
At age 20, that is very, very early. Wow. Why would you think age 20 is a recommended age?
Okay, so by age 20, the breast would have fully formed. Yes, and the woman is already in her puberty.
Wow, then we have a lot of work to do, because our younger generations, at that time, they should be in the universities, and then this education really has to go out there so that they can do their self-examination and then prevent themselves from getting breast cancer. With regards to lifestyle choices, what do you think are some of the lifestyle choices that we can make to prevent us from getting breast cancer or to reduce the risk in getting breast cancer?
I think the first one will be our diet or the nutrition. So the nutrition should be adequate. We should make sure we include vegetables and fruits in our diets, and make sure that you have enough water, enough vegetables, and whatever you can afford, including the proteins and then the right amount of carbohydrate. Exercise is also very important for us. We should engage in exercise at least 30 minutes a day. It's okay for us to do that, and then also try to maintain adequate weight. You shouldn't be overweight or underweight. You should be within the normal limits. We should avoid alcohol and then smoking as well.
All right, so now Dinah, I'm 20 years, I have adopted this healthy lifestyle, I eat well, I exercise regularly, I've done self-examination. Will family history play a role in getting breast cancer?
Yes, it has been recorded that family history has a role to play. If there have been someone within the family that has been diagnosed of breast cancer before, there is a chance that you might have, or a woman or a person might have inherited that. But then, with that being said, currently, the cases that are being recorded, most of them have no family history. So we are recording index cases in families that are having the breast cancer. So yes, family history plays a role in the breast cancer, but then most people do not have that history.
Wow, so eating well. Portia, I want to add something.
I want to add that when we say family history, we are referring to first generation, either siblings or parents, very close relations, not grandfathers, brothers, something, not the long distance, but very close relations.
Okay, so I'm eating well, I am exercising, you've advised that I eat vegetables, I eat fruits, I maintain healthy weight. Are there certain foods that I can also eat that can predispose me to getting breast cancer? Dinah?
All right. I won't say there is certain or particular foods or medications that you will take that will expose you, because it is debatable on some of the medications that are available, because evidence will tell you that no, some will say yes, and so it is debatable right now.
Yeah, so if I exercise regularly, I eat well, my chances of getting breast cancer is highly reduced, I should say, based on all that you've mentioned. And so this is a form of awareness creation and education for all of us, for all women, that you'd have to maintain a healthy weight, you need to eat well, you need to examine your breast regularly. How frequent should we do the breast examination on ourselves?
Ideally, it should be monthly after the menses.
Every month? Wow. Every month? Every month, Portia? Why every month?
Every month, because we just want you to get used to your body so that it's easy for you to detect changes early, and then you can report early and it will be managed. The earlier we detect breast cancer, the management and then the survival is better.
Okay, so whilst you're advocating for us to examine ourselves monthly, what are other signs and symptoms that I should look out for when I'm thinking of breast cancer?
Okay, so some of the signs include the breast lump, as we generally know. Usually you may feel a lump in the breast. It may be painful or it may not be painful. You need to report it. We also have the nipple retraction, where the nipple is drawn in, which was not the case initially. There may be nipple discharges, there may be breast changes. The skin of the breast may change, where there will be some deep dimpling. You find small pores. No, it's not on it. There may be pores like the orange skin. Pores.
Okay.
Small holes on the breast. That side feels hard. And then the color may change a little. We call it the pale orange. It looks like the orange skin. That is a very classic sign. And then the nipple discharges, there may be fluids coming out from the breast when you squeeze. It can be bloody, it can have a foul smell. It doesn't smell good. You need to report all that to the hospital. And then sometimes the lumps can be in the armpit. That's why I said it's very important for the woman to start the breast examination from the armpit. We have lymph nodes in the armpit, and so when the breast becomes inflamed, those lymph nodes becomes enlarged. So it's very palpable. When you palpate the armpit, you can easily feel those lymph nodes. So the woman needs to report to the hospital. There can also be reddening. The breast will become reddened as compared to the other one, and then it can be enlarged. It can be quite bigger than the other one. Some are painful, some are not painful. And we want to say that it's not all lumps that indicate that the person has breast cancer. So if you see any of these signs, report to the hospital. It is the clinicians that will examine you, and based on their examinations and investigations, they can now diagnose if it is breast cancer or not.
Wow. So then getting used to your body is not a bad thing. Standing in front of the mirror touching is not a bad thing.
You can also examine yourself in the shower or whilst lying down. Just make sure you examine and you are used to your body.
Okay. Wow. So with your experience, I'm sure you've gone out for outreaches, you've doing programs, you've met people with breast cancer. Dinah, can you tell us some of the experiences on the field, the breast cancer, how early people report, some their prognosis, if they seek early health care, what happens to them?
I mean, we have people that went in early and it was caught early at the early stages, and so we have survivors. That's why you would hear breast cancer survivors. It's because they went early, it was caught early, they went through the treatment and they are fine. But then the problem is when we don't detect it early. You know how the breast is, as my sister was saying, if there is a lump deep in there and you are not examining it every month, you would not feel the lump, because some are not painful. And so it will be there for a long time, and then it will be spreading. Then by the time you come, it's gone out of bounds where we cannot do much about it. So yes, we have survivors there that the disease was caught in the early stages and they were managed.
Okay. I also would want to find out, some people are scared that they will lose their hair when they go for the treatment, and so they would want to protect themselves and not go for treatment. What do you have to say about that as well?
I mean, this is quite sensitive. You know, women, we love our hair. And so, yes, people will say that if I go for the treatment, I'll lose my hair. But as compared to losing your life, it would be better to lose the hair that you would gain later than to lose your life completely, because you are important to somebody. You are somebody's wife, somebody's mother, and somebody's breadwinner. And losing you would cause more harm than just losing the hair.
Portia, so when you go to the field for your outreach programs, what are some of the misconceptions and myths you hear about breast cancer that leads to the late reporting that you earlier said that people come in with?
Okay, so some say breast cancer is associated with women in their old age. So even if they detect the lumps, they try applying ointment, herbs to it, seeking other forms of treatment than reporting to the hospital. And so breast cancer is not only associated with the elderly. Now almost all the age groups are affected. Yeah, and some also think if you have breast cancer, you are certainly going to die. No, that's not the case. The earlier it is detected, the more the chances of survival. You are able to get treatment and then you recover from it. So breast cancer is not a death sentence.
Wow, thank you for clarifying that for us. Diana, do you have more to add?
Yes, I think going on awareness creation, one that comes up a lot is that when you allow a man to suck your breast, then you are preventing the breast cancer from, I mean, no man can suck the breast cancer away from your breast. And so the fact is, if you have a partner that is consistent with you intimately, the person knows your body. And so if there is a change, the person will see it that, oh, this was not here, but it is there now. And so that is what we talk about when we encourage that when you are intimate with your partner, the breast must be accessible to your partner. And that is only if the person is consistent. You see, so if someone you engage with different people, they are not consistent, and so they will not know your body. They are not going to suck any cancer cells out of the breast, but they know the body, they know the breast. And so if something is becoming abnormal, they are able to.
I bet men are coming to come at you because of what you just said, because then they took it in a whole different dimension and then they were doing all sorts of things. And so you clarifying this for us, please expect a lot of questions with regards to this one from the men. Yeah. So as part of your celebration, you looking at the theme is Stronger Together, Uniting Efforts for Prevention and Support. What do you plan to achieve with this theme? Stronger Together, which people are you looking at to build a strong force in breast cancer prevention?
We are looking at everyone. If we come together, we can fight this. Because if people are shy of going out there with their breasts for it to be examined, then it means we are going to hide with the disease and we are going to die with it. But then coming forward and then empowering the public will enhance some form of collaboration between the general public and then the health sector, and then empower their knowledge in terms of the signs and symptoms and where to go to if there is a problem. So coming together, if you examine it yourself and there is a problem, you don't go to anybody, you suffer alone. Yeah. But then if everybody is aware of the signs and symptoms and you are able to talk to the other person, the other person may say that, oh, let's go here, or I think I heard something about breast cancer, so let's go in for expert examination. So that is what we are looking at, being strong together, not standing alone, the whole community coming together as one to fight this. Because as we are seeing, early detection is what saves life. And the early detection does not lean on just one test.
You have to talk about it. Wow. Are there any programs that you're going to do within the month with regards to Breast Cancer Awareness Month celebration? I'm sure this is the first program you are doing for this month. So do you have subsequent ones for the month?
Yes. Subsequently, we are planning on screening. So you can walk in, we'll have a designated area where we are going to do the breast examination.
Here in Uhas?
Yes, in the midwifery department, we'll have some clinicians around who will do the breast examination. And if we have any issues, we will refer them to the whole teaching hospital.
Is it for free?
Yes, it's for free.
Okay, so I just have to walk in and then tell you that I want to get my breast examined. Okay, thank you very much. We'll go for a short commercial break, and when we come back, we'll talk about advocacy, how we can champion breast cancer prevention, support survivors, reduce stigma, and then break the taboos surrounding breast cancer. conversation is getting super interesting and we have lots of questions from our audience, and so we'll go to them and listen to the questions they have for us.
Yes, I want to know, we have a lot of breast cancer survivors in town, so how best can we support them socially and emotionally? Thank you.
Thank you once again for the opportunity. Please, my question is more of a myth. I know you've not gotten to that part, but there's something that I think the public would be interested in, because during some of our interactions with women, there have been some misconception about when a woman develops breast cancer and then one of the breasts is taken out. Later in life, the other one too can somehow also be taken out. I want to know how true that is. Thank you.
Okay, Madam, please, I want to know, are health workers also having effects of breast cancer? And if yes, I want to know the reason why, because I know a health worker who recently died out of breast cancer. And I know that since they are health workers, at least they should have had some ideas about it. So I don't understand why they give us the information, but yes, so they are dying out of.
Thank you very much. I would also like to know whether breast cancer is a contagious or dangerous disease, and more so, how does the condition affect the social interaction of survivors?
I want to find out if men are susceptible or can also develop breast cancer, and whether they are also invited to the upcoming breast screening.
So Portia and Dinah, we have questions from our audience. So Dinah, I would want you to answer this for us. Someone is asking, is there support for breast cancer survivors in our communities?
There is support. There are societies that the survivors join and they get support from that side. But then breaking it down to the communities, I mean, because of the misconceptions surrounding breast cancer, some people think maybe someone has become or someone has been immoral. That's why the breast cancer comes in. And so those misconceptions does not really bring a harmony in the support that they actually need, especially in the communities that they find themselves. But aside that, after every treatment, they are part of a greater community of survivors that support each other.
Okay, so these support groups help them come together and then support them emotionally, and then social inclusion. How do you think breast cancer survivors relate with others? Do they feel stigmatized when you go for your outreaches? What is the situation out there? Do they feel stigmatized out there that they can't relate with people?
There is another misconception that breast cancer is contagious.
Oh.
And so that in some communities is what brings about the stigmatization.
Okay.
But then we should know that it is not a disease that is contagious. You cannot get it by the mere fact that you are talking to somebody or you are hugging the person or shaking hands with the person. So that being at the back of our minds, we should improve how we care for these people, because it is a struggle to go through the breast cancer, the treatment, the medications that they will take, the whole treatment, the journey, and probably losing a body part, the hair, the breast, the emotional toll it has on them. Everybody should embrace them in their homes, in their community. They need the support more than any other person. So as people in communities, and in Ghana, we value community, the communal thing, we value it. So if we understand that it is not contagious, we understand that they are going through a lot or they've gone through a lot, and we open our arms to them, that they get shoulders to cry on. We do not stigmatize against them. We do not body shame them in any way. Then it will improve on how they also survive after surviving the breast cancer.
Have you experienced people talking about the spirituality rate of breast cancer as an issue in the community? So they think that if you have breast cancer, then you're probably being hunted by a witch, or you've done something bad and something is happening.
Yes, I have, and that brings about the late detection, because most is attributed to witchcraft. Is attributed to some forms of spirituality, and so the first point of call will not be the hospital, but then prayer camp, and then by the time we get to the hospital, it would have been late. So that also is a part of the journey of breast cancer. So let us be aware that yes, as human beings, that we attribute some things to spirituality. We would find causes in the spirit, but then with breast cancer, let's go to the healthcare facilities, because early detection
save lives. So you've been detected as having breast cancer. We are employing that you rush to the hospital, go for medical attention. The prayer, yes, keep praying, but then go for medical attention to buttress all the prayers that you are praying. And Portia, if I have my first breast taken out, is there a probability that a second one would also be taken off? Or if one of my breasts, I get breast cancer in one of them, is there a likelihood that the second one too would get affected?
Okay, I think this is a question that surfaces most of the times we talk about breast cancer. Yes, there's a possibility that the cancer can affect the other breast, and so sometimes people prefer to take both breasts off so that they have 0% chance for breast cancer again. If there are no breasts, then there will be no breast cancer. So yes, there's a likelihood that the other breast can also be affected.
Do men get breast cancer?
Yes. Men also have some breast tissues, and so they can also get breast cancer, even though breast cancer is rare. It's not very common among men as compared to women.
As healthcare professionals, the question came in very clear that she has witnessed some healthcare professionals having breast cancer and then they report late. What do you think accounts for healthcare professionals reporting late, though they go out and do the advocacy?
I think it's more about the how do I call it? The stigma associated with breast cancer. We are, let's say, people who prefer to keep their diagnosis a secret. So once they are diagnosed with breast cancer, they do not want others to get to know about their condition. So it's very difficult for them to seek care, even in the facility they are working, because eventually their colleagues will get to know this is what they are suffering from. So getting treatment, and that's what delays the diagnosis and then the treatment.
Wow. What is the way forward here? If we have to break all these stigma that we are encountering, because as Ghanaians, we value our community, our social interactions, our values as Ghanaians is rooted in a lot of things from the old. And so what is the way forward, Dinah, for us, so that we can break this stigma, we can break these taboos, we can let people feel included in the society regardless of their diagnosis?
Bringing the knowledge of breast cancer down to the community level. So talking about breast cancer at every meeting, every opportunity that we get, we talk about it. Because if you do not know about something and it is happening, you wouldn't know that it is that thing. So if you don't know that these are the changes that occur in the breast to alert you that it is breast cancer, you would sit down and be looking at other places for management or for medication. And so talking about it in our communities, in our churches. So we are advocating that our reverends, our pastors, they should open their doors for the healthcare workers when they come in to talk about breast cancer. Because if the church member knows that this thing that is happening, it might be breast cancer, she gets up early and then we detect it early.
Then I think October is not enough. It should be done throughout the year.
Yes. Yes. It should be all the time. Whenever we get the opportunity to talk about it, we talk about breast cancer. Because it is not only in October that you have people coming in with breast cancer. So all the time, we should be open to listen to someone that wants to talk about breast cancer.
I think we can also incorporate it in our care for women, the care packages we have for women as general. As clinicians, maybe if a woman is coming for family planning, you can offer them the services of breast screening, because women will only come to the hospital if they have a problem. But for coming for routine checkups, wellness clinics is something that's difficult for us. And so at every opportunity we get to see the women at the hospital, we can offer them that service, and I think it will go a long way to help them.
If you just joined us, this is the Breast Cancer Awareness Month celebration show, proudly organized by the Department of Midwifery and the School of Nursing and Midwifery right here in Uhas. For the past 1 hour, we've been discussing breast cancer, that's what it is, the signs and symptoms, how we can examine ourselves, detect it, report to the various facilities, and seek early care so that we can save lives. This year, the Department of Midwifery has themed the Pink October, Stronger Together, Uniting Efforts for Prevention and Support. We all need each other. And so let's join hands, let's not stigmatize, let's go out and educate people, talk about it, let's make noise about it so that people get to know about breast cancer, and let's bring the survivors together. Let's talk to them about it, let's give them the hope that they need so that together we can have a strong community. It's been a wonderful time having our seasoned guests with us discussing breast cancer. We would like to say a very big thank you to you for spending your time with us in this wonderful education. We also would want to thank the Department of Midwifery for initiating this program and helping us educate everyone about breast cancer. We also would like to thank the Directorate of Public Affairs in supporting us host this program. To our virtual and in-person audience, we couldn't have done this without you. Thank you for having the listening ear, and we hope to meet you next year.
Thank you everyone for all the efforts you put in for a successful program. I want to say a very big thank you to senior management for the support that they gave us for this program to be a very successful one. I want to thank faculty for the time that they put in and making this program a very successful one. I will say a very big thank you to our audience and everybody who came around to participate in the program. Early detection saves lives. Everybody get screened now.